Hello, West Michigan. I'm Lynda Balkema, and you're watching Alive and Well, a program about keeping healthy. And here today, my guest is Dr. Stephen Zonca, and I'd like to welcome you, Dr. Zonca.
Thank you for having me on the show, Lynda.
Oh, I'm so glad. I have so many questions for you, and we're going to fill this hour up with lots of fun and interesting conversations. And I want to start by saying people just think that plastic surgery is for the rich and famous, or a lot of people still believe that it's for the rich and famous. And now it's more affordable, more accessible, and we all would like to get a little work done. But it isn't always just about having cosmetic work or for the people that are vain. There's a real necessity for plastic surgery. Particularly, I have a dear friend who you've done quite a bit of work on, and she said that it was okay I mention her. And she just thinks you've done wonderful things for her. She went through a double mastectomy with breast cancer, and you have completely reconstructed her, which is so good emotionally, psychologically. It just does so many wonderful things for people. So we will talk. Let's start talking. First of all, you went to Wayne State Medical.
Correct.
And 7 years in North Carolina.
We did 7 years of residency after medical school, including training in Detroit and as well as in North Carolina, where I completed my plastic surgery training at Wake Forest University. And there I got a broad training in not only the cosmetic surgery, but the reconstructive surgery, as we've talked about, for breast cancer, traumatic wounds, and injuries.
You're also co-director of wound care. Did I read that?
That's correct.
At Mercy?
My partner, Dr. Thayer, and myself are the directors of the wound center at Mercy Hospital, and we also see patients both in the hospital as well as out of the hospital for a variety of both acute as well as chronic wounds. Ranging from pressure-type ulcerations to lower extremity wounds, and we have a great team that helps out some very challenging problems for people.
Okay, well, wow. So you're a very busy man. I see you specialize in breast augmentation and tummy tucks. Tummy tucks is a kind of a big thing right now, and a lot of people that have bariatric surgery, I'm sure, after following bariatric and losing a lot of weight rather quickly, there's a lot of loose skin. So we'll talk about that later also. I see that you're also doing research on some silicone implants.
Right. There was a 13-year moratorium on the use of silicone implants by the FDA. The FDA back in 2006 has brought the silicone implants back on the market, including some of the research that we've been involved in, and not only the research during that interval time, but following that, there is subsequent studies that we're participating in, which the FDA is following women who've had breast implants. The real question early on was whether there was any relationship to breast implants and connective tissue diseases, things along the lines of rheumatoid arthritis or lupus, and all the research has shown that there is no correlation between breast implants, whether they rupture or not, or these rare rheumatologic type or autoimmune type diseases. So,
well, that's good to know, because I have read that there's been a concern about the links. And how many years have they been using the silicone implants, did you say?
Silicone implants were the original implants put in, and they were actually introduced in the mid-1960s. And so they have been around for quite some time. And the reality is that a breast implant is probably not a lifetime device. They are very durable devices, and they can last 20, 30 or more years, but they may not last forever.
Okay. So you might have to go in for a new one every 20 years. But doesn't that happen with hip replacements and knee replacements or similar?
They also have the potential to wear out. And the reality is that the implants that we have today are better than the implants that we've ever had. And they actually come from the manufacturer with a lifetime warranty against rupture. And they do stand behind their product very well. The reality is that some people will have trouble with the implants. Trauma is one potential source of rupture for an implant. I've personally had patients who one was thrown off a was involved in a motor vehicle accident and had significant bruising on her chest, and her implants were just fine. But I've also seen people who have had implants that were put in the early 1980s and one was in a car accident, another one was in a skiing accident, and they after more than 25 years, their implants were probably more fragile, and they did require replacement after a significant trauma.
So then you're saying that they actually ruptured, so then is there leaking of the actual silicone into the body, and that they've found
the body actually walls off the silicone in the breast, and the evaluation indicated that yes, the implant was ruptured through an MRI, and so we simply went in, removed the old implant in the silicone, and put a new implant in.
Okay. Well, we have some implants in front of us, and I want you to explain to me the different types of implants, the different types of breast augmentation. I know there is. I looked up the names earlier, and you'll have to help me. I know that augmentation is actually enhancing the breast, right?
That's correct.
Enlargements. And then, I should know this one for personal reasons, but reducing the breast is...
A breast reduction, yes.
Just a breast reduction. I was thinking there was a technical name that I'd seen for that. So you do reductions, which is also helpful to women who just happen to be very large-breasted.
Absolutely.
Let me tell you, it makes a huge difference on your back and your shoulders.
It's certainly, both procedures can be life-altering procedures.
Yes.
We have two implants here right in front of us. This is a saline-type implant. It's actually filled with IV fluid or saline, and the shell on that is actually the same as this silicone implant. The silicone implant is filled with almost gummy bear type material.
Wow.
If you would actually,
it's sticky.
The newer type implants like this, if you cut across them, they actually don't go anywhere. They're a semi-solid. Even though it has a much more natural tissue type feel.
It does feel.
And they are a premium implant, and like I said, we're very happy that these are available again to women for not only breast reconstruction, for example, after they've had their breast removed for cancer, but also in women who choose to have an enhancement, because the reality is that especially after pregnancy or breastfeeding, the breast can lose volume in the upper portion of the breast. There can be some loss of volume to the breast itself, and women are left with more skin than they have breast tissue to fill it out. And so an implant can be a very nice outpatient surgery, quick recovery, and allow them more comfort in a variety of clothing, swimsuits, without feeling like they don't have the shape that they had before, allowing them to get back to where they were before. West Michigan is very conservative, and we've all seen reality-type TV shows of people out west, and the reality is that most of the implants that we put in are in a very moderate range, whereas if you've seen some of the reality TV shows, that they're certainly...
They do much larger implants,
they do.
There's no doubt.
And that's not what we most commonly do here. Most commonly, we're just... For example, filling out the shape that a woman had before, using the skin she had.
So they can feel good about themselves and feel good in their clothing. Okay, I see we have one other type of implant here.
That's actually an expander, and this is what we would put in after, for example, a breast would be removed. This is a temporary device which allows us to stretch the skin and muscle to create room for an implant.
Before you can go up to the next.
Exactly, because there's just not enough skin and muscle after the breast is removed to put a full-size implant in. We put this temporary implant in. We actually fill it after the skin is healed. We add volume right through this port here in the office. Just takes a few minutes.
And right here in the office.
We add more volume to stretch the skin and muscle.
And so there's a port through the skin?
The port is actually integrated right into the implant. It's right in the device itself. It's metal, and so that you simply put the little small needle right through there. It adds some volume, and usually the skin is numb there because again
they've recently had that
surgery where the breast was removed.
We're going to take a break, and we've got a lot to cover here yet. And stick with us. Thank you.